I'm going to begin by gathering my supplies. My linens include a bath blanket to keep my patient warm, a fitted sheet, a draw sheet, a flat sheet to cover them with when we're finished. I will reuse my patient's bedspread or blanket. I have a patient gown and a pillowcase. I also have my washcloths and my towels for bathing. I have a basin of warm water, toothbrush and toothpaste for their mouth care or mouth care swabs, lotion, soap, a cup of water for brushing the teeth, and an empty cup for spitting after they have brushed their teeth, and my gloves. The patient could also spit into a kidney basin. I'm going to enter my patient's room. I'm going to wash my hands. I want to introduce myself to my patient, and I will let my patient know what we're going to be doing. I'm going to ask my patient to state their name and date of birth while I'm looking at their identification bracelet. Now I will provide for privacy by pulling my patient's curtain. I will begin by brushing my patient's teeth. I'm going to raise the bed, put my patient's head up. I'm putting my patient's head up so that he doesn't choke as I'm brushing his teeth. I'm going to put his side rail down and put on my gloves. I will drape my patient so that he doesn't get wet while we do this, and place some toothpaste on my toothbrush. I'm going to brush his teeth, making sure that I cover all the tooth surface area. Now I will offer my patient water to rinse with, and then offer a cup for him to spit. Alternately, you can use mouth swabs. I have covered my patient with a bath blanket for warmth and privacy. As I am bathing him, I will move his linens down as I go, keeping him warm and covered. I have untied his gown at the neck to loosen it to begin the bath. This is how to wrap your washcloth around your hand like a mitt. I want to place my hand in the middle third of the washcloth and fold it over, and then fold it in half towards my hand and tuck it under. I'm going to place both of my washcloths in the warm water. One is for washing and one is for rinsing. I'm going to wring out my first washcloth so that it's not dripping. I'm going to begin with washing my patient's face. We never use soap on the face. I'll begin with his eyes, starting at the inner canthus and moving outward, using a different part of my washcloth for each stroke. I'm washing around the ears. Sometimes there is breakdown on the ears, so be very gentle in this area. I've rinsed my cloth. Now I'm going to move to the arms and chest. I'm going to pull my patient's gown down, keeping her covered with the bath blanket and exposing only the area that I'm going to be washing. I'm going to place a towel under her arm to keep the bed dry, and now I will wash her arm. I'm going to put some soap on my washcloth and put my soap to the side or in a soap dish. Careful not to put it in the water, make the water soapy. I'm going to be starting with the hand and moving my way up. Careful to support the arm as I'm doing so. Now I will rinse thoroughly. As I'm doing this, I want to make sure that I've thoroughly rinsed all the soap off because I don't want my patient's skin to become dry. Now I will pat dry with the towel. I would then put up my side rail and move to the other side and wash the other arm, but for demonstration purposes, I'm now going to move to the chest. I'm going to put soap on my cloth and wash the chest. I'm going to displace the breast, wash under the breast, and rinse thoroughly. Now I will pat dry. Now I will put my patient's gown on, but I will not tie it in the back since I still need to wash the back. I'm going to put the side rail up and lower the head of the bed. Now I'm going to be washing the leg, so I am going to hold onto the bath blanket and pull the linens down. I've exposed only the area that I'm going to be washing. I'm going to take off her sock. I'll place a towel under her leg. I will start at the top of the leg and work my way down to the foot. Once I get to the foot, I'm going to be very gentle, looking and assessing for areas of skin breakdown. We also need to clean between the toes. Now I will rinse off my soap. And pat dry. I would then go to the other side of the bed, wash her other leg, but for demonstration purposes, I'm going to move on and wash her back. I have assisted my patient to a side-lying position. She has a pillow for support of her head and neck. She's covered for warmth and privacy. This is a great time to assess the skin on the back for any signs of breakdown or redness. The sacral area is especially prone to breakdown. And now I will rinse off all my soap. And pat dry. Now I will be washing the perineal area. I will be starting at the front and washing towards the back, with each swipe using a different part of the washcloth. The final step will be to wash the anal area. And gently rinse off my soap. And pat dry. Now I will place this in my hamper. Never throw linens on the floor and don't hold them close to you. You can apply lotion if you would like.